Hi, my name's Mike Forster. I'm a member of Socialist Alternative, but I'm also the National Chair of Health Campaigns Together, a campaign group which has been fighting for the last 5 years to maintain and improve national health services. Last night we were all moved by the tremendous applause that members of the public gave to health service staff all over the country, which has also been happening all over the world, and thank you to everyone who participated. The reason I felt I wanted to say something is that I also saw Boris Johnson appear on the steps of 10 Downing Street, a Tory who has collaborated along with the government over the last 10 years in slashing, cutting and privatising the NHS, and now they're applauding staff who are on the front line. Let us make this very clear that we knew in January that the coronavirus was going to hit this country, and yet no preparations were made. Instead, we were being told that we should develop a strategy of herd immunity, that there would be a few deaths, but they would be expendable, and if we all carried on going out, we would be immune to the virus. That clearly was mistaken science, driven by a desire to maintain and keep open businesses. So we're now being told that we're all in this together. I have to say, I don't agree. The minimum projection now is that there will be 20,000 deaths in this country over the next few weeks. They are preparing field hospitals in London and now in the West Midlands, along with mortuaries of 4,000 bed capacity. You know what is coming down the line, but all of this could have been prevented. We knew what was coming. If we compare ourselves to Italy, they have 2,500 more ventilators than we have in this country. 4 times as many intensive care beds. What this therefore means is that we are completely underprepared. And when we're applauding nurses and doctors on our doorsteps and in the windows and on the streets of number 10, let us remember this. Nurses have not had a pay rise for 6 years. There are 100,000 staff vacancies in the National Health Service. They have demoralised and cut our NHS to the bone, and that's why we are now unprepared. And this has been done by a callous, uncaring, conservative government that has the hypocrisy to stand on the steps of Downing Street and applaud NHS workers. We have faced an avalanche of cuts, privatisation and closures in the National Health Service. Just take the issue of NHS Logistics, who do the testing equipment. Their transport network has been outsourced to DHL, who then outsourced it to Unipart. In other words, they have privatised the delivery of testing equipment. If we'd had tests in place and contact tracing in January, we would have been able to prevent the spread of the virus. They have privatised cleaning, they've privatised catering, they've privatised portering in our hospitals. They're saying they wish to continue with the closure programme of accident and emergency departments all over the country. So our nurses are completely unprepared with the PPE equipment that they've been provided with. It's totally inadequate. As Dr. Horton said on Newsnight last night, they don't have the right gloves, they don't have the right visors, they don't have the right aprons. We're putting our nurses and doctors on the front line who will be vulnerable, and some of them unfortunately will die. This is all preventable. We are not in this together. So to those of you who are applauding the NHS, thank you. When we're asked to go out again, let's applaud, but let's say one other thing. Let's say a few other things. We will not and we cannot allow this to continue. We need a properly funded National Health Service. We need to end the cuts, the closures and the privatisation. We need to say that our nurses, ancillary staff and doctors deserve an immediate pay rise, and they must have the equipment that they require to carry out their jobs properly. The message that needs to go out is, yes, support the NHS, but never again let our health service be funded in the way that it has been by this government over the last 10 years.